Hi, this is the third and final video on indigestion. Peptic ulcer disease. Peptic ulcers are open sores in the lining of your stomach. These are called gastric ulcers, or the upper part of the small intestine. These are called duodenal ulcers. This happens when your stomach acids eat away the protective layer of mucus in your digestive tract. Duodenal ulcers are more common than gastric ulcers, and men have a higher occurrence than women. Peptic ulcers present with episodic burning in the stomach, usually 1 to 2 hours after eating a meal. The pain can be relieved by antacids. The primary investigative tool is endoscopy. And as we discussed previously, endoscopy is a non-surgical procedure used to examine a person's digestive tract. Using an endoscope, a flexible tube with a light and camera attached to it, your doctor can view pictures of your digestive tract on a screen. Complications associated with peptic ulcers can be perforation of the ulcer, in which an untreated ulcer can open up through the wall of the stomach or other area of the gastrointestinal tract, allowing digestive juices in food to leak into the abdominal cavity. This presents with sudden and severe pain. Bleeding when the ulcer erodes a blood vessel. Severe bleeding, known as hemorrhaging, can be a life-threatening event. Anemia because of chronic blood loss. Carcinoma in the case of a gastric ulcer. Obstruction in the form of pyloric stenosis, which results in the blockage of food from moving out of the stomach into the intestine. The objective of treatment is to relieve the symptoms, heal the ulcer or ulcers, prevent complications, and minimize the possibility of having a recurrence. Surgery may be needed if the peptic ulcer disease does not respond to treatment or complications develop. Let's discuss H. pylori, or Helicobacter pylori. For decades, doctors thought people got ulcers from stress, spicy foods, smoking, or other lifestyle habits. But when scientists discovered H. pylori in 1982, they found that the germs were the cause of most stomach ulcers. Helicobacter pylori is a type of bacteria. It can cause sores, called ulcers, in the lining of your stomach, or the upper part of your small intestine. Infection with H. pylori is common. H. pylori can be diagnosed with a urea breath test. You will drink a special liquid that has a substance called urea. Then you'll breathe into a bag, which your doctor will send to the lab for testing. If you have H. pylori, the bacteria will change the urea in your body into carbon dioxide. And the lab test will show that your breath has higher than normal levels of the gas. As we discussed earlier, your doctor may also decide to use endoscopy to get a better look at your ulcers. The procedure may also be used to collect a sample that will be examined for the presence of the bacteria. Treatment for H. pylori consists of taking 3 medications for a 7 to 12-day period. A 7-day antibiotic regimen containing lansoprazole, a proton pump inhibitor, amoxicillin, an antibiotic, and clarithromycin, an antibiotic, can be used as first-line therapy. Well, I hope this helps. Have a good day.